Welcome to Birds.Bees.Bodies, a Planned Parenthood of Southeast and North Florida podcast where we break barriers, tear down stigmas, and promote open discussions on sexual and reproductive health. Get the buzz on topics from puberty to menopause, contraception to conception. No topic is off limits. So sit back, relax, and let's dive into a judgment-free zone to promote sexual wellness. Welcome, everyone, to another episode of Birds.Bees.Bodies, brought to you by Planned Parenthood of Southeast and North Florida. We're excited to be in season 2 of this podcast. We had a great first season with so many interesting topics. And as we are moving into season 2, we're talking about Pink Project Day in this episode, and we'll get a little bit into what Pink Project all means, but it is Breast Cancer Awareness Month in October, and we do this every year at Planned Parenthood where we try to raise awareness. I'm Michelle Quesada, Vice President of Communications for the organization, and we have some incredible guests joining us for this podcast today. Laura Goody, who's our VP of Public Policy at the organization, and Rachel Eisenberg-Stein, who's also a nurse practitioner and has done a lot of awareness for us in the media and in the community on what we do at Planned Parenthood. So thank you so much both for joining us. Laura, I know this is like a very near and dear topic to you, talking about breast cancer and talking about prevention and care. And so I want to jump into, kind of why we do this. Pink Project Day was something that we came up with a few years ago. And we decided, every October, if we're going to raise awareness for Breast Cancer Awareness Month, let's make sure that we can get the community out and get free services, right? So we offer a free breast and pap check day at all of our health centers across the state. And Laura always helps us get the word out, with a very touching story of kind of what happened to you and how you found out about your situation, if you want to share.
Yeah, sure. So I'm happy to be on. I usually work on like the advocacy campaigns and in the legislature and mobilizing our volunteers. But I always say, there's so many reasons that I love working for Planned Parenthood. And one is that I really don't think I would have detected my breast cancer as early as I did when I was 44 without the awareness that Planned Parenthood spread. I remember, it was Mother's Day, and we had a very touching ad that Planned Parenthood nationally was sharing around Mother's Day to remind people to do self-exams. And I quite honestly didn't. I did do my mammograms, but I was 44. So, I think you hear more and more that people are getting breast cancer. More people are getting breast cancer younger and younger. So I was surprised, and I did catch it at stage 2. So I was really, really fortunate. But it was because of that awareness, I really wouldn't have thought to do it. So it's just so important that people are on top of their healthcare and have those routine mammograms, but also also the self-exams, right? And I wasn't really sure. And my doctors were even like, how did you find that so early? I was like, because I'm an expert at this. But so yeah, and everything's fine. I've been in remission for, 7 years now, honestly. And so it's, I really credit Planned Parenthood for that awareness.
And I think it's one of those things where nobody ever thinks it's going to happen to you, right? Like you always feel like, oh, well, I'm healthy, I'm young, I'm taking care of myself. And even if you're not, right, it's not something that crosses your mind. But it's so important to do these checks. And I wanted to bring in, Dr. Rachel, just because, you were a part of the Pink Project last year, and you felt all the momentum and all the excitement at our health center in West Palm Beach. Talk a little bit about some of the questions patients had, or what they came in, like, were they coming in for the free services? Did they know that it was for awareness for breast cancer? Kind of what was the feedback you got?
Yeah, so I am a big supporter of Pink Project. I think it's a phenomenal thing that we do. One of the biggest barriers to healthcare that I've noticed in patients getting pap smears and breast exams is the financial aspect. So this is a huge thing that brings a lot of people in door. I actually think that Florida Mango is almost booked already for Pink Project Day. I'm very big at promoting it because I know that's a barrier. So every visit when a patient comes in, it's really important to me to discuss those recommendations of care. Some of the guidelines have changed in the recent years. There's different organizations that recommend different things as far as self-breast exams go. But I am a big proponent. You know your body best. So you're usually going to be the first one to detect a change. So I always recommend, just if you're in the shower, laying down, feel from your armpits actually into your breast, because you can notice a change there in your lymph nodes first. So last year it was amazing. I think that we saw at Florida Mango alone, I think over 20 something patients. I'm unsure about the numbers specifically, but I know it was a really big hit. We decorated the center in pink. We had beads out, we had flyers, people asked questions what it was for, who didn't know and who weren't there for that. And we were also able to provide them with those services. And now people come in, okay, when is going to be my free PAP day? And what does it mean? And the guidelines consistently change, like even with cervical cancer screenings. They changed the age recently. It was 25, and now it's starting anywhere between the ages of 21 to 25 with or without sexual activity. So it's really important for us to educate our patients and answer their questions. And with reproductive health care being in the forefront these days, a lot of people are certainly concerned. And I believe that there's a lot more questions regarding people's health, which is a wonderful thing in that aspect, allowing us to shed awareness on the situation and the changes. So I try at every visit to educate patients, and I know that a lot of our providers and staff throughout the organization do as well.
For our listeners, so we have 8 health centers across the state, and we had a couple dozen patients at each health center that came out for Pink Project Day. These are appointments that we reserve in advance, and I'll have all that information during the podcast on how to do that. But I want to get back to something that Laura said earlier about more and more younger women are increasingly becoming diagnosed with breast cancer. And there was actually a research study that was done that found a 20% increase in diagnoses among women born in 1990 compared to 1955. So we're seeing more and more women under 40 who are getting diagnosed with breast cancer. And, there's several, I guess, theories you can come up with why that is. But it's one of those things where, like, growing up, I never was like, I never learned, about the stressors of being able to get emphasis on getting tested early on. I thought, oh, that's something I don't have to worry about until way later in life. But no, it's something that you should be getting tested routinely early on. And same thing with cervical cancer screenings. They're getting your PAPs done every year, every 3 years, depending on the recommendation. Let's talk about early detection, because for Laura, that was that was life-saving for you, the fact that you caught it so early. Sometimes you'll have, obvious symptoms, like you'll see that there's something different about your breast, and sometimes you won't. Dr. Rachel, do you want to talk a little bit about like what you might notice, or in how many cases, or is it common for you to not notice anything until you go to the doctor and then something comes up?
Yeah, so early detection's key. And I actually think that part of it is, or the majority of it is you discovering it on your body, since you would notice the changes if you feel, or even your partner. If you're in a relationship or you have a partner, they can recognize changes and say, hey, I noticed something here. That's a big thing that brings people in. I do think that it has been happening in younger generations, and partly maybe because education and partly for other reasons. But I always recommend that you feel, it's not always painful. It's not always tender. I know that's one of the key things that everyone says, but it's not. It's just something that's typically in one breast and not both. Typically, it's a pea-sized nodule, or there could even be skin changes. Called puta orange, which is just fancy for meaning when your skin kind of looks like an orange peel with all those pores, or if you notice like indentations or nipple discharge. Those are some of the key things that I say you should not wait on, and you should always come and be seen. And one thing is, a lot of people feel like you're talking about when you were younger, you didn't really know, it wasn't really spoken about. Males can get breast cancer too. And when I tell them, a lot of them are very shocked, but it has a lot to do with your family history as well. So, asking about family history, educating them on the risk factors, and bringing that to light plays a really big key. And I think there's a stigma behind age. Laura's saying 44, like, I didn't think anything of it. And, most people think that they're okay until they're like 50, between 40 and 50. But I've diagnosed it in people as young as 27, who came in because they noticed a mass and they were the first person in their family. So I think that I want to break the stigma and the barrier to age. There is no number. Whether you're 25 and it's recommended to start breast exams, you can be 18 and notice something. That is typically when your breast tissue is formed and you may start to notice changes. That would be significant. So anytime you notice something that you have a question about whether you think it's normal or not, I always say that you should get that checked. And we can always answer any questions or concerns. And diet can also play a role, and hormones can play a role in growth of things that may be non-cancerous and benign, but you wouldn't know until you ask those questions. So never be embarrassed, and always come in if you have any inkling of any change in your body. I think that's important to point out, that age should not matter.
And if you do, find something, and Laura, you could talk about your experience as well, because you decided to come out to Planned Parenthood and get checked when you found a lump on your breast. What was the further testing that was done for you after that? It's you got checked, and then now what?
Yeah, so then you went for deeper radiography. Again, I'm not a medical professional, but they had to do even more imaging to go deeper. Um, you know, um, I have a question, I think, for Dr. Rachel. One of my dear friends is actually diagnosed with stage 4 breast cancer. She is also under the age of 50. And she has very dense breast tissue. And so what she said was, I had my mammogram. They didn't say anything, but I mean, she was in remission, and now she's in stage 4. So what is, I think, like the dense tissue, what's that about? Is it harder for people to detect it that way?
Yeah, so a lot of times when you have dense breast tissue, it means you have thickened tissue. So sometimes a standard screening mammogram wouldn't just be the only step. A lot of times when we're doing a clinical breast exam or based on a patient's history, we sometimes actually would refer to more diagnostic imaging, like an in-depth diagnostic ultrasound, in addition to the bilateral screening mammogram, because that gives us a chance to dig a little deeper and see a more diagnostic picture, especially with that thickened breast tissue. And again, there could be many factors that's why she has dense breast tissue. But when you do have that, it is sometimes harder to visualize or to palpate. So the imaging with that is really important. When you have dense breast tissue too, depending on what they see on your imaging, sometimes they do recommend like short-term follow-up. So of course, we would always refer you to a network of breast specialists and educate you on the next steps, because that's important to have those resources and to know the next steps and what are you going to do. And like you were saying, you went for a slew of tests. I'm sure at some point you had a biopsy. And whenever someone sees that on their results, recommended biopsy, that's a very scary thing. And not knowing the knowledge or what can come next from that, that's important for us as providers to recommend. Also, if you have a history of fibroids or dense breast, or you have a history of imaging in the past, I always recommend, if possible, to go back to the same imaging site. That's very important because they can actually compare your prior films or images and see if there's any changes that may be a key to finding something that may be new or growing. That's a
I
great
can,
question.
yeah, I can also say, and I know that several of my people that I know had this issue. The imaging center closed down where they had to compare with the death. Actually happened to me. So I
Wow.
was like on a search to, like, because my doctors wanted to compare it. I mean, they had already done the biopsy and knew that I had cancer, but we were not able to compare it. So how important is it to like stay up to date with that information, the continuity of care, and yeah.
Yeah. So I always recommend that if a patient comes in and they're like, oh, I had a mammogram last week, I say, can we get a release of records just so we can have it on file, even if it's normal or per patient, it was normal. So I always recommend whenever you go to a doctor's office, whether it's us or an imaging location, to fill out a release of records when you're there so you can get a copy of your records and keep it on file. And even if it's just the paper and not the CD, that's okay too, because we'll be able to read it and compare the studies. And at least you'll have it electronically in one version of a chart. So you can always print it and have access to it wherever you go. That's the beauty, I think, now of the electronic charting systems. Most bases even allow you to fill out release of records online electronically without having to make the commute. So I always push for that. So even if you forget in the moment, contact them and have that filled out so you can make an appointment and keep your records. That's very important because it's true, your insurance may change. So where you're able to go may change, or the imaging site may be gone. That is a big possibility. So I always say to do a release of records in the moment when you're there. So that way you can keep a file, because you're your own advocate as well. We're your advocates, but you're the primary advocate. So that's important.
Absolutely. And we talked about at the top of the podcast about the barriers that can keep people from doing their routine exams, from getting checked. Obviously, cost is a big one, right? We see all the time that patients who don't have insurance, it's too expensive for them to pay out of pocket to get a pap smear or to get the breast exam. We solve that problem for you. Like, the services are free on October 21st. I know finding the time is also challenging, but if you can plan ahead, it's a couple weeks away. Just plan ahead to be able to make the appointment. Transportation is another one I feel, right, Dr. Rachel, that you hear from patients, like, I can't always get to a health center, I can't always get to a clinic. So, we try to kind of meet the community where they're at. And these exams don't take very long, right, Dr. Rachel? They're pretty quick. So it's not like you're gonna miss, a whole day of work or half day of work to be there.
Yeah, and fear. I think fear is also a fear of the unknown. Some people have never had it done, or their last experience was painful and traumatic. So just remember that every person and every visit is different, and we can always mend the visit for your needs. So if the PAP is what scares you the most, tell your provider. They can always get that out of the way and do that first, and then you can have a conversation about the findings and answer your questions. So that way, the thing that is you're fearful of or that you had a bad experience with in the past potentially or never had is done and out of the way, and you can do the breast exam. So we can always change the exam around to make you feel comfortable, because that's our goal. We want to make sure that we answer your questions and make you feel comfortable, and walk you through the process. But it is fairly quick usually. Usually it's literally less than probably 3 minutes for a pap smear and maybe 3 to 5 minutes for a breast exam. So the whole exam total probably takes about 5 to 10 minutes. And that's it. 5 to 10 minutes can save your life. So, I know fear is a real thing. I know there's stigmas behind going to a doctor. People don't want a male doctor. They don't want the metal speculum. They're scared of what it will feel like. So I always try to walk them through what they're going to feel. And I think that's important. And we do use plastic speculum. So let me put that out there. It's not as cold or painful. And we use a speculum based off of an exam. So it's the right size and fit for you. So it won't be painful. And a pap smear is just 2 brushes inside your cervix to check for abnormal cells. So it feels like someone's kind of sweeping inside of you, I guess is the best description that I give, and a little tickle. And it's 2 turns and done. So I know it's hard to overcome it, and it takes a lot to step through that door and to get there and to put it into your schedule with life, because everyone has a life. We recognize that. But if you have concerns, just let your provider know, and we're always going to accommodate you and try to make you feel as comfortable.
I didn't plan this, but I'm actually getting my PAP today at 2. So I'm making sure that I'm like keeping up with that because, it is managing your own healthcare. And, the doctors always ask me, when was your last PAP? And I'm like, oh, don't you have it in your records? They're constantly asking, when was your last period? All of these things. So it's like, it's hard to manage all of that, especially with like electronic records and different providers. But I'm going to make sure that I'm putting it in my phone and my notes so that I'm always on top of it.
I want to go back and talk about the fact that a lot of people who get diagnosed with breast cancer never had any symptoms to begin with, right? And that could be really challenging because that's the hardest part for someone to say, well, I never felt different. I never noticed anything different. Like, how would I have known? And that's where those key exams come into play, because your doctor and your provider is looking for things that maybe you wouldn't normally see or notice that are different.
Yeah, so actually, I think also misdiagnosis is part of that. So symptoms, some people think they don't have symptoms because maybe they're breastfeeding, and maybe they think that they have mastitis, but there can actually be breast cancer. That's actually something that occurred with one of our patients. She had mastitis in the past, so she was being treated for mastitis. No one actually touched her breast, and she lost her insurance, so she came into us for a prescription. And I had to say, this doesn't feel right. There's something here. She goes, but this is what it felt like last time. There's nothing different. I know this is what it is. And I said, okay, sometimes you have to barter. And I was like, I'll make a deal for you. If you go for your imaging today and it's negative, I will send in those antibiotics right away. But I want to point out to you, this may feel normal because this is what you're used to in the past. But when you feel a lump in one area or it feels hardened, you want to get that looked at. And to most people, that's their normal breast tissue because they're not feeling it every day. And she went for the imaging that day and it was not mastitis. So I think that's also the thing, is making sure that someone touches you. And even if you feel that nothing is wrong, just getting checked, because usually it's not painful. I know we hear a lot that it is painful and that it's tender. But that's not always the case. Breast pain certainly can be an indicator. So if all of a sudden you have like sharp shooting breast pain, or one breast is larger than the other, even if it's a slight change, I mean, it's normal to always have one breast larger than the other, but things that you may not think about because that is normal. If your right breast has always been larger, but now it's growing in size significantly, something to think about. If you start having breast pains in one side, or it's really tender to touch, like your breasts start feeling, your bras are hurting, they're tighter, and that's never happened to you before, always good to get that checked as well. Those are things that people don't think about because they think, oh, it's hormones, oh, it's ovulation, or oh, it's my clothing, it's tight. But those can be something that is different that we can pick up on and that we can do an exam to check for.
Yeah. And is it always on or around your breast? Could it be over by the armpit area or somewhere else?
Yeah, so actually you have lymph nodes from your armpits into the side of your breast, known as the talus spence, which is one of the most common places we find breast cancer. So also if you notice a change in your lymph nodes where maybe they're inflamed or they're warm, or we call them shoddy, which is just meaning it jumps under your touch, or it's tender, also you really would like to get that checked. Nipple discharge. If you have always had nipple discharge because of a piercing or you were breastfeeding, but you notice that there's more or the color's different, that is something to get checked. Yes, you may have nipple discharge, but if the color or the amount changes, or if it's one side and not both all of a sudden, that's something to also look for that people may not question because they're like, oh, since my nipple piercing, I've always had discharge. That can be normal. Or since I was breastfeeding. So those are things that people sometimes don't look into that we should, because it's not always a mass. It's not always painful, and it's not always just in your breast. It could be from your armpits. I say armpits, that's not really professional, but armpits into the side of your breast or your nipples. It doesn't just mean that there's a lump. There's many different forms of breast cancer.
Right. And Laura, I want to get back to your story. I know we've talked about this so many times, but like after that experience and going through that, I'm sure you were extremely shocked to find out you even had breast cancer. At this point, you're like, oh my gosh, I just went to get checked out just because I saw this and it resonated with me. But after the fact and going through the treatment and going into remission, like what was that process like for you coming out the other end? Like I'm sure you've been so grateful to have this chance to have gotten treatment and learned about it so early. Anything that you can share with the listeners about that choice that you made to get checked and how it all worked out in the end.
Yeah, I had a full mastectomy and reconstruction. I've since had another surgery. I was kind of empowered, that I was taking care of my own health. I really didn't work out before then. And so I've been going to the gym since then, like for 6 years every morning. And every time, it was not necessarily why I had the breast cancer, but it was very empowering. I have a shirt that I wear at the gym that says, yes, they're real. They tried to kill me. The real ones tried to kill me or something like that. like just trying to do like a push-up. I couldn't, right? Because of my muscles. But like now I'm doing push-ups, I'm doing pull-ups, and I feel stronger. And I love telling people about it and telling my story, and sharing that with my friends and family because I want to be here for a long time. So I think I have a couple questions about cost. I'm so glad we are doing this, at low cost. I know that the Affordable Care Act, covers preventive services, and I know that Planned Parenthood takes insurance, but there are still quite a few people that are not able, like, privately employed. I want to say my hairdresser actually, and, she is always asking me, I can't afford the marketplace. When can I get, breast coverage? So could we talk a little bit about cost? I know that we're doing this free day, but what are the other kind of parameters around that with Planned Parenthood and other providers?
Yeah, I can speak on that if you'd like. So we actually have different resources depending on where the patient lives, where we work with different organizations throughout the state. And if they qualify, it actually helps cover the cost for their visits. In the state of Florida, we work with a wonderful program called the Breast Cancer and Cervical Cancer Initiative through the Department of Health. So if they qualify financially, age-based, they cover the breast exam, mammogram, and any follow-up or testing or specialists that are needed. And same thing with the pap smear, like testing for that or any further testing that would be needed based off of the findings. And then depending in your county, I know in Palm Beach, there's something called Palm Beach County Project Access. In Broward County, there's something called CL Brumbach. And then there's also Susan G. Komen, and they also do screening based off of finances and or family history that covers breast screenings and mammograms throughout a lot of our health centers. So those are the ones that I kind of know down in South Florida. But BCCI does go through Port St. Lucie. So But there are programs in every county. So I always say to reach out to your nearest Planned Parenthood center or our affiliate so we can give you those resources, because there may be some in the community that you aren't aware of, that even if you can't make it to Pink Project, there's other things that we can do to assist you to make sure that you're getting the health care that you need.
Great. Yeah. And we always work with our patients. I mean, even for all of our services, if you don't have insurance, there's lower cost, affordable options. There's other ways to be able to get help to cover the cost of your care. So we always tell patients, like, just come in, talk to us, share your situation with us. We don't turn patients away. We always try to work with you to figure out how we can get you the care that you need and deserve. And so I just want to give the details again on Pink Project Day. It's October 21st. It's going to be at all of our health centers. You can find a list of our health centers at our website, ppscnfl.org. You should call and reserve your spot. As you heard earlier in the podcast, Dr. Rachel said at Florida Mango, the spots are filling up pretty quickly. We do continue to see patients for all other services on that day. So we do have to designate a certain amount of appointments just to Pink Project. And so we want to make sure everyone gets a chance to come in. Call 1-800-230-PLAN to make your appointment, and just let them know in the call center that you're calling about Pink Project and that you want to make the appointment for the free breast pap check day. This is just, something that we have done year to year, and it's been a huge success. We had more than 100 patients last year that we helped. And to Rachel's point earlier, when she talked about how some patients come in really nervous about the PAP exam, we've had health center supervisors who have held patients' hand during a procedure because, like, they were so scared. We're compassionate people. Our staff is dedicated to what they do. They try to make you feel as comfortable as possible. Like Dr. Rachel said, they walk you through how it's going to happen, what's going to happen, so you know what to expect. And it's really just a quick exam. The breast and pap exams are very quick. Going back to, obviously Pink Project is great. We hope that we get a huge turnout and that we get people that we can help and provide the service that day. What beyond that, we do send you home with materials for you to know what to look out for. But like Dr. Rachel said, like, how can I continue to stay healthy after I've done my exam and make sure that I'm doing the best I can to prevent any future situations?
Yeah, so kind of to touch back on what Laura actually said about her health and um, making sure that she keeps track of her PAP, because when was her last PAP? So that's something that we do. Every patient, whether you had your PAP with us or not, we do track it. We have something called a cervical cancer screen where we put in the date of your last PAP smear so we can remind you every time that you come in. You also get alerts on your record to remind you, and we do give lots of education. So what can you do to prevent it? Condoms are a big thing for cervical cancer. HPV, that's been a hot topic that's been discussed before in this podcast and out in the community. Vitamins play a big role in that. Higher immune system, the more our body can sometimes fight off or suppress those abnormal cells. And then keeping your follow-up appointments. You were there, everything was good, but just making sure that you have those routine checks yearly, or you have the follow-up that was recommended to you, so we can make sure that there is no change. Look out for symptoms of bleeding. If you notice any bleeding after sexual activity or randomly, if you notice genital pain or a change in your discharge, come and be seen. Don't be shy. That way we can make sure that everything's okay and point out things to maybe look for. And like you said, people will hold your hand if you want, but we also are wonderful in the fact that if you wanted to bring a support person with you, you're more than welcome to have them in the room with you. We can even play music. We've done that before. It's fun for us. It relaxes you. So nothing is the limit. Don't be shy to ask us what we can do to make sure that you do keep those appointments and come in.
I love that. And no question is ever off limits. That's what I love about our Planned Parenthood staff. Like, we're there to answer all the questions, no judgment, just ask away. And I do want to say that even though this is a one-day event in October, we do offer year-round, healthcare with pap smears, breast exams. Anytime you notice something, just book a wellness exam, book the appointment, and come in to get checked out. If you notice changes in your body and there's something that you want to talk to your healthcare provider about. And I wanted to point out the statistic about early detection. It's pretty shocking. Like, if you find anything earlier on, the early detection survival rate is 99%. So I think it's 99.9% is the survival rate for early detection within 5 years. So I think that that's important to get out in the community, and just how, raising awareness about this, being educated, knowing that it's important to stay on top of your health. And, we're not just about care. We want to connect with you. So if you want to learn more about our services and what we do, and, we talk about all reproductive healthcare topics on our social media accounts at PPSCNFL. You can find us on TikTok, Instagram, Threads, Facebook. We also have our Birds.Bees.Bodies blog on our website, ppscnfl.org. And of course, you can listen to our podcast on Apple, Spotify, YouTube, and several other platforms. I thank you both so much for being a part of this. I'm excited to see the turnout for Pink Project Day, and hope that we get a lot of appointments, a lot of people that are committing to their health and taking advantage of this free day. Anything else you would like to add about it? It's just a really fun day. Like, the entire health centers get decked out in pink. Some health centers will do cupcakes and sweet treats. Others will do other giveaways. So it's just a fun day.
Yeah, it's an explosion of pink. You can't find a table without a pink cover on it or a pink lollipop somewhere. The whole health center really goes all out. We have banners. We do have cupcakes. Patients really like that. I don't think we have pink drinks, but maybe we can find pink lemonade. We didn't do that, but everything else you could imagine: lollipops, mints, treats, covers, necklaces, bracelets. We love it. We have it. You can take some home as a souvenir. Maybe even a sticker. Maybe we can get those for you. But it's a really fun time, and it's a very charged environment that day, and a lot of education, and every day in our health centers, but especially that day. It's a big rally where everyone comes together in the community, and it's a really meaningful day to us and to our patients to be able to provide that service.
Yep. And make sure you hashtag Pink Project to let people know that you were at Planned Parenthood and you got checked out, and you're encouraging others to do the same. Thank you.
And helping with the navigation is amazing. Telling your friends and family. I think that's really key.
Absolutely. Thank you so much. We appreciate you. Have a great rest of your day, and come see us on Pink Project Day.
Thank you.
Bye.